Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. And I'm here at 9701 Sarah and Court, Dublin, California, 94568. My phone number is 408-687-1899. Anytime if you are suffering from any disease at any age, call me for your second opinion, or if ever you want to be treated with the scientific homeopathic treatment, you can call me at 408-687-1899. We are discussing the process, or you can say the journey of life. And journey of life starts after the meeting of sperm and ovum in the mother's fallopian tube, and after that it has progressed. All these things systematically, what happened, where happened, and when happened. Everything has been described systematically in the mother's bubs, and after that, after coming out of mother's bub, and especially that mechanism when how it comes out was taken care of in these lectures. And ultimately, after being delivered out of mother's bubs, its life, how it was facing and what it was facing and what were the problems at that time, we have discussed in these lectures. And ultimately, we divided the life into newborn, toddler's life, and adolescent's lives, pre-adult, and the adult age of the lives. And when we were discussing all these things systematically, we reached at the conclusion that we should discuss about the life, about this body, this how this body was formed. Since we were giving a story that how the sperm meets with the ovum, then how they fuse with each other, and all that story was given to you. But here I'm talking about the cells. When both the cells, they are known as haploid cells. When both the cells join each other, when both the cell joins each other, how they develops. So after that, a complete cell was formed when they join each other, and that cell has its own definite components, and those components are performing their individual duties in each and every cell. Cell may be of different kind, just like the cell of bone, cell of muscle, cell of nerve. All these things, they are different kind of cells, but the duties of the internal organelles inside the cells are the same, and the same contents are performing the similar type of duties in every type or every structure of the cells. Then after that, we have described about the composition of cells. The composition of cell was made up of the wall, cell wall, and we described about the cell wall, how the cell wall is formed, and what is the structure of this one, and what is the duty of this cell wall, and what is the speciality of this cell wall. All these things were described in a systematic way, in a detailed matter, that this wall has no door of entry, no door of exit. But even then, uh, going and coming into the cell is continued. The traffic goes in, traffic goes out. That traffic is contained of oxygen. That traffic is containing of the food materials, and ultimately carbon dioxide and other waste materials produced by the cell from this food materials are coming out. But how they are coming out, we have described in detail about the permeability of the cells. So this permeability we described, and this permeability is going on not only in one cell, but all these trillion cells, they are forming this body. So all the trillion cells are performing their own duty. And when we enter the inside the cell, we cell everything is known as cytoplasm. And cytoplasm is a jelly type structures in which all the other it has its different environment. It hasn't just like our environments. In our environments there is always the pressure of 480 mm of mercury. This pressure is continued in our environment on our body. The same way, there is a fixed type of environment inside the cell into the cytoplasms. And under that definite or particular type of environment, inside the cell wall, you can say, there are many more organelles, and those organelles are working, and they are able to work according to their specified environment inside the cytoplasms. And ultimately, every organelle has its definite duty they are performing to, and that is visualized as a whole in broad spectrum on the body. This body is a type of screen, a big screen. Every cell performs, every organelle inside the cell performs its duties, and the combination of all these cells performing in a combination of duty that which is expressed on our body. And in this way, all the organelles, when they are working normally, they produce a normal life. A normal life is produced means all the organelles in the cell. When I talk about the cell, does not mean that only I'm talking about one cell. I'm talking about the trillion cells. They are performing their function and the normal functioning of the life force. So in this way, I have discussed about the protoplasm. I have discussed about the nucleus. And inside the nucleus, there is the protoplasm. It has its own environment and specified special type of environment inside the cells, because it's a special type of features are stored inside the cell, which are related to the forefathers, the previous generations of the cell, previous subdivision of the cells. So in this way, we have described all these things, and ultimately, and the garbage, everything when goes to the metabolize whatever the food material is going inside is metabolized and is produced into wastage as well, and that wastage is expelled out from the cell, from the same cell membrane, and it is known as permeability, a type of pressure which is exerted from outside and things go inside. Particular type of pressure is exerted from inside, and things go from inside to outside. So in this way, everything has been described. And after that, we started the structuring of this body by the different cells, by the different organs, and by the different systems, because there are 9 systems working inside the body, and all the 9 systems are composed of various organs, and each organ is composed of tissues, and also tissues are composed of the cells. In this way, the single unit of a body is known as a cell. So that cell we have described in detail, and after describing all that, we started the structuring. The structure was, this whole skeleton is standing because of the vertebral column. So vertebral column we have described about the internal neural canal, external horns, and after that, from the coccyx to the foramen magnum, when the atlas vertebra is uniting with the foramen magnum to the skull. So everything has been described, that it has, first of all, 33 different segments, you can say, the vertebrae, you can say, and ultimately those vertebrae are joining, and they form different sections: coccyx, sacrum, and there's if we start from the downward, coccyx, sacral, lumbar, thoracic, and also the cervical. So cervicals are 7, thoracics are 12. These are in pairs. Remember that. Lumbars are 5. Then after that, sacrals. Sacrals are 5. Ultimately, they unite and form one. Coccyx are four. Ultimately, they unite and form one. So, in this way, the fusion of the vertebrae, uh, when they are calculated, they forms only 26 vertebrae. So, in this way, this structure we have described, and after that, we have described the brachial, shoulder girdle. Shoulder girdle below the neck, the whole body is converted into three portions. We divided it to discriminations. The upper one is the skull, head, and head is composed of skull and the face. And we have described each and every bone which is taking part in the formation of the skull and which is taking part of the mouth, face as well. So everything was described here in this way, and ultimately this head is joined with the body. Body means trunk. Trunk means it has two main portions. Two main portions were the upper portion is known as thorax, the lower portion is known as abdomen. And ultimately, this abdominal portion was also again divided into two portions. And one is proper abdomen and the other one is pelvic area. So this lower division is not visible outside. Just like the division between the chest and the abdomen is visible, you can see the structures of the bones, the hard bones upside and below the hard bones in the upper boundary of the abdomen, and the downward is the abdomen. So in this way, we have divided the total trunk into two portions. First of all, chest and abdomen, and then abdomen divided into two portions, proper abdomen and the pelvic areas. But this division is only internal. We cannot see it from outside. We cannot assume it from the outside. Just we can, you can say, surface anatomy. By the name of surface anatomy, we can figure it out. What is the boundary of the lower segment of the pelvic area? What is the boundary of the upper segment of the abdominal area? So in this way, all structure, all the sections were described. All the structures were described. In this way, we have the internal section were divided by the name of peritoneum, sac of the peritoneums. The abdominal organs were wrapped up in the greater sac of peritoneum. This pelvic organs, just like the uterus, prostate, fallopian tubes, ovaries, and everything was covered up into the broad ligament, or the other name is the lesser sac of peritoneums. So in this way, this is the internal division which is not visible outwardly. So in this way, we describe all these things, and after that, we describe the shoulder girdle, which is formed by the clavicle bone in the front, and in the back side, the scapula bone, and on the side, it forms with the union of both frontal and the posterior side is scapula bone. It forms the joint which is known as shoulder. And this both side shoulder joints, when they are uniting from the back and from the front, is known as shoulder girdle. So in this way, pelvic girdle was also structured by the three bones of the hip, ilium, upper portions, ischium, lower portions, and pubic area. All these bones are in a circle. They unite each other and form a type of brim, the gilder as well, you can say it, and just like we form a beam. So in this way, it's a second beam which is formed here, and in this way, in this structure, we can this body is connected to, and this body is formed in a uniform stage. So after that, we started that different organs, different section of this body, if they are having any problems inside it, just like I can tell you about the skull. Skull is composed of 7 bones, and we have already described all those bones, and they unite and form a globe of the head. And everything about this structure of the globe, how it was formed, when it was soft, what it was having, just like the fontanelles, anterior fontanelles, posterior fontanelles, and also the foramen magnum, and all these things we have described about the skull. And now we are talking about that there are some organs. It's not only one organ inside the skull, there are various organs inside the skull. Just like when I told about this one, I told you that there is a type of a village inside the skull. Means different houses, different walls, their boundaries. In the same way, the different organs are situated inside the skull, and they have their boundaries, and they are covered or wrapped by a membrane like meninges. And there are streets, just like you see the streets in the village, and every house is united to the attached to these streets. That's known as ventricles. So in this way, structurally, we have described everything that this skull has inside. These are the structures, and so after that, we are proceeding. There's many phones are coming up in this way, and I just want to convey to all those persons, please, from 5 to 6, I am unable to pick up the phone. Do not call at that time, but after that, after 6 p.m., after my program is over, yes, you can call me back, and I will answer your phones, or leave the message so that I can answer you after my program is finished. So in this way, I described with you, I told you about if there be any damage inside the skull, and how we can come to know. In the initial stage of medical science, when there was no technology type of X-ray, just like the other many type of the other devices are now we have created, CT scan, or ultrasounds, many things now we have that we can find out what's going on inside any organs. We are talking about the head, and we have described about that if there are some signs of abnormalities inside the skull, what will happen, how you can recognize outwardly that this is going on inside before the devices came in. Because devices are in the lab test, and devices when you go to there, the devices when you consult the doctors, and ultimately he refer you to the labs, and after that it comes in existence. But before that, when any damage has occurred just now, you have any hit, or some of the tumors are gradually developing inside, or some of the leakages of the blood or serum or anything, CSF, cerebrospinal fluid, etc., may be leaking inside, or maybe there is excess of any fluid, or maybe there's a lack of or scanty fluids inside the skull that can produce some type of problems, tumor, cyst, all these things. So, in this way, how you can come to know that inside the skull something is going on which is wrong, which is pathological. So, I told you there are various signs and symptoms. With that, you can recognize that these symptoms are associated with any person who came to you for treatment, or who go to the hospital, or who is sick, in other words. Who is sick, in other words, will will not tell you, but you can see from his face, just like I told you, yeah, just dropping of the eyelids. And even if you open the eyelids, he has enlarged pupils. Then he has pupils without any sensitivity to light. All these things I have described time to time. Convulsions, vomitings, ecchymosis, many things we have described that these are the signs and symptoms. Outwardly, we can see that this person is having this kind of condition inside, maybe tumor, maybe cyst, maybe leakage of blood or of serum or anything, or fracture of the bones outside. So in this way, after that we are now describing with you that second portion is the neck. Neck attached head with the trunk, and that middle portion is known as neck. That neck is also considered as a pathway from head to the trunk. So this is a type of a pathway, and in this pathway, many structures from head to down or from down towards the head comes and go. Is a traffic is continuously going, working is continuously going and coming back. If ever there be any problem, if ever there be any problem inside your neck, how you can come to know before you go to the hospital, before you can check with the doctor, and the doctor prescribes some test, and then the test results come up. A long way you have to go to find it out what's going on inside. But I'm telling you, whenever anything happens inside the body, anywhere, it is represented by the outwardly expression. Means when I was talking about this thing, I told you about the just our environment. Just like we dial a number here for India, and immediately bell rings over there, the person contracts because there's no gap in the environment, and the instruments which are attaching to that one, they are having capacity to receive the messages and convey the messages in this way. And the second example here I gave you about the pond, water pond. Water pond, the water, there is a completely, there is no gap in between the water pond. So ultimately, if you put some stone inside the water, it makes a circular waves. You can see that as far as your eyes can see that, you can see this thing. But if the pond is too wide, big, just like sea or river or everything, you can go, you cannot do that, see that for a longer distance. So ultimately, those waves, circular waves, continue to forming, and they are up to the end, the other corner, the next bank of the river or next bank of the pond. It goes to that well because there is no gap, and it is on the same movement, just like if single body, you touch it from the back, from the front, the whole body as a whole feels it. Whole body feels it. In the same way, this universe, or these are the structures I'm talking to, are compact structures. They do not have any gap in between. And if anything is added to that one, the whole structure feels that one. That something has entered into the body, something has happened into the body. Or in this way, when you put a stone, that is why the stone waves are felt, or the reaction or action of the stone passing into the water is felt up to the bank of the stone pond. So in this way, I explained that if anything happens inside the body, anywhere, it is represented by some of the external signs and symptoms. And those external signs and symptoms are indicated that's what's going on inside, because there are different signs and symptoms represented outside indicates, because there are different kind of structures inside. So what type of structure has been damaged, it is indicated by different type of signs outside. So in this way, we described about the head, skull, and after that we have started describing about the neck. Our neck is a compact structure. Many things are passing from head to downward to the trunk. It's a medial thing. So from back side, if you start that, you will see the vertebral column. First of all, there is a vertebral column, and you know the structures of the vertebral column. I have just described about that one, and in this structures you can say, uh, just in front of this structure or in between the vertebral column, blood vessel. The nerves are going to from head to the neural canal, and they are controlling the different organs at different sites, and ultimately you can see that this there are carotid arteries. You can see carotid arteries are those arteries subdivided to right carotid artery, left carotid artery. These are those arteries which are throwing blood, which are transporting blood from the left ventricle to the skull, to the head, you can say, in internal organs of the skull. So in this way, in the neck, they are passing from here on the both sides. And ultimately, there is a true carotid veins, and also there is a nerve. So all these lymph channels are also going from upward to downward. So in this way, these are the main structures which are passing through the neck. And after these structures, there are some other structures. These are the structures, just like you can say, food pipes. The food pipe starts from mouth, and from mouth, throat, afterward, the portion is known as pharynx. And then there is a junction, epiglottis, where the other portion of the food pipe starts, that is known as esophagus. So these portion of pharynx, portion of esophagus, they are passing, or they are uniting inside the neck here. So in this way, these are also taking part in the formation of the neck. And if something happens in the pharynx, if something happens in the esophagus, if something happens at the junction, because there was a big importance of that junctions where they unites each other. And also the respiratory system, just like a back of the nose, there is a pipe, windpipe, there is a respiratory pipe that's known as larynx. And larynx also comes to the epiglottis area. At that epiglottis area, where I told you about that one, that there is a change of track, of these vessels. Just like the nose comes in the backside, first of all, but when it reaches to the epiglottis area, ultimately it comes forward. And the food pipe is normally in the front side, but when it reaches to the epiglottis area, it goes out backside and outsides. So all these things, speciality, I have described you that this epiglottis area has a special type of junction, crossing junctions, and which changes the track of these two pipes. So if ever anything happens to the food pipes, if ever anything happens to the air pipes, it will be indicated externally by some of the signs. And I will describe you those signs, that if the neck is damaged internally, what organ has been damaged, and what it will indicate outwardly, what type of signs you can see outwardly without doing to any scan or x-ray or anything else. you can come to know from the symptoms that inside the neck there is some changes, something has happened. And these are the signs of a particular type of a food pipe changes, particular type of respiratory type of changes. All these organs are passing from here. So in this way, we have described all these signs and symptoms, and now we are just giving you a brief survey of the neck. So in this way, first of all, I will discuss about the ecchymosis. If something happens, if something happens to the blood vessels, and some blood vessels are oozing blood inside the neck, but that is not coming out from the skin. Means skin is in contact, but the internal damage are not openly visible out the skin. So in this way, we can assume, we can see some signs of this kind of conditions, and out of that conditions which comes up, that's known as ecchymosis. Ecchymosis, when the blood is oozing under the skin, blood is oozing under the skin, and the oxygen, because blood is red, everybody knows that, and the oxygen is sucked up from that blood by the cells, by the adjoining cells. And when the oxygen is taken up from this blood, which is oozed out of the blood vessels, it it sheds a shade of this kind, black, blotches type of color. This is known as ecchymosis. So if there be any ecchymosis with the history of any jerk, any tumor, any accident, whatever, and on the neck you see that there is a ecchymosis, you can well figure it out that in the neck any artery or any blood vessels has been damaged, which is oozing blood outside. And even minor injuries which has not caused any damage to the carotid arteries or carotid veins, but it has teared down inside the neck some muscles, and they ooze the bleedings. Under those conditions, even then we can see the ecchymosis. After that, the swelling, edema, that's known as edema, swelling. So swelling edema may appear when there is a injury by any blunt instrument, there is an injury to the neck, and with that injury to the neck, there is a swelling outside. When there is a swelling outside, it's of two kinds. One is known as hard tumor, the other is known as cyst, the soft tumor. When you touch, it feels that it's a soft, or it's not having any ecchymosis type, hematoma type, redness on that area. And when you are not having that kind of swelling, then it may be, if there is a redness, if there is a ecchymosis, blueness, it indicates any blood vessels has been damaged. But if these tumors appearing on the neck are soft but palpable outward the neck, palpable outside the neck, separately, you can see that that is all because of internal damages into the tissues. And there is not much bleeding coming out, but only the interstitial fluid or the water from the ventricles has been ruptured, and that water is flowing out of their structure, whatever their structure is, and they run that, they work in that one. But now it says that this oozed blood, this oozed hematoma, if it's red in color or blue in color, it indicates hematoma. Hema means blood, toma means tumor. Blood tumor, or that ultimately, if it's tight, hard, it is known as tumor, and if it's soft, then it's known as a cyst, and it depends upon whether this cyst is filled of any fluid, whether this cyst is filled up only of swelling, and whether this cyst is filled of any blood. So all these things will show you the different changes inside the neck, and you can recognize from outside that in the neck after the injury or after the tumor, these are the indications or conditions inside the rectum. Sorry, neck. We are talking about not only for food pipe, but we are just talking focusing on the neck. So in this way, in the neck, if these blood vessels are ruptured and something has oozed out, serum, CSF, or blood, they are indicated by soft tumor, they are indicated by hard tumors. Just like if you fill air in the football, and first of all, without the air, the football is soft. You can press it out. And if we fill the air into that one, ultimately it becomes hard, tight, and you cannot press it. In the same way, if oozed blood inside the skin is too much, it tightens the local tissues, just like the bladder we are talking about. Then it is very difficult to press it. It's hard. Just like to fill more air, it becomes hard. More air, it becomes more hard. And this way, the excess of oozing of blood or the cerebrospinal fluid inside the tissues, which is showing up as a tumor or as a cyst, we can recognize it. Soft means still not hard. Hard means it is tumor. So, in this way, we have described in our previous lectures that if the neck is damaged and you see a bump on the neck, and that bump could be of two types. Either it is swelling edema or it is hematoma. The difference between these two, I have already told you that the hematoma is looks like bluish in color or red in color. If it's fresh, it is indicated by the blue redness in the color. That means the blood has just oozed. When the oxygen has been sucked up from this oozed blood, and there is remaining a residue of the blood, that becomes blue, ecchymosis types. And this will indicate the condition internally of the neck after any injuries. But there may be any tumors. Always remember, if the tumor is in the neck, if the tumor is in the brain, sign and symptoms appear very gradually. Sign and symptoms appear gradually, so that as the swelling increases inside, the tumor increases inside, it is pressing to the side by organs of blood vessels, and their function is gradually slowing down, and the swelling is increased. It indicates the swelling is increasing. And if there is anything happened, rupture or swelling or anything, suddenly by injury, when it is suddenly by injury, then all the signs which are we are seeing here, ecchymosis, we are seeing swelling, we are seeing edema, we are seeing hematoma, whatever I have talked about, all these things will appear immediately just after the injury. So, two things I told you. If it's a tumor gradually developing because it has its own speed, it will take time, so that the local symptoms will gradually develop. But if it's a rupture, immediate after the injury, the sign and symptoms are appeared very fast. So this is the difference in between there. Moreover, the tumor, the pressure of that one is causing the problems in the normal functioning of the adjoining organs, blood vessels, and all that. Then under those conditions, gradually their function will be deteriorated. Function will be abnormal or less. So in this way, we can find it out. Suppose if it's a minor injury, but even then some blood has oozed inside the skin, that will be indicated outwardly. It's not affecting the respiratory organ, it's not affecting the food pipes and all that. But it's a small injury, not that big, outwardly on the neck. So means the skin is damaged. Inside the blood vessels, the tiny blood vessels has been ruptured with the injuries, and that is indicated because skin has three layers: epidermis, dermis, and hypodermis. Hypo means lower down, under, which is mostly attached with the bones, so or the muscles. So in this way, if anything has happened under the skin, and then outwardly on the epidermis, we see scratches, signs of scratchings on the neck, and it will be at the same side where a person was hit or has been injured. In this way, this is known as lacerations. So lacerations, tumors, hematoma, swelling, all these things are the indications of anything that something has happened in the internal neck. How severe it is, yes, you can figure it out. Simple scratchings, minor things. Edema and progress of the edema, gradually or fast, will indicate the nature of the problems inside, means it's a tumor. But a hard hit to the neck will indicate himself on the neck by the swelling, edema, or hematoma. So, all these are the important things we have to discuss in this lecture, because it's an interesting thing that we should remember and we can recognize in the first instant. If a person has been injured by the neck, then ultimately we can figure it out what's going on inside our neck. So today, my time is over. But even then, before going to close this chapter, I would like to tell you that there are some indications what has happened, what may have happened inside the neck after injury, or even after tumors. You can say the divation, diversion, or deviations, you can say changing position, deviations of the trachea. So our trachea is just in front of the neck. It's a cartilaginous structure which covers the larynx, the respiratory organs, as well as in the back side there is a food pipe. So these things are protected by the trachea. Trachea is a cartilaginous bore, and cartilages are structured just like a spring. And in this way, the first thing, when something happens or somebody hit the neck from one side, there will be deviation. Normally, this trachea is in front of the neck. But if somebody hit from the right side, it will be distorted and it will having a deviation to the opposite side. So this thing we can indicate, because all these signs I told you will be represented outside. And this trachea in front, you can palpate it, you can see it that it is not in the normal positions. Then, if a different kind of structures I can describe here before I go. Emphysema. It's a type of conditions when in a localized area, the transportation going and coming, just like in the cell, I told you there is a cell wall. There is a cell wall, but still there is a transportation coming and going. Traffic is going. But if in a local area, after injury or anything, this traffic is blocked. Blood vessels are coming in, supplying the food. Veins are going out and throwing out the blood, as well as accumulation of the garbage in the cells. All that one. Suppose if both are with the swelling, with the injury, both are blocked, and they are not entering into a part of the neck, part of the cells of the neck. So what will happen? In these conditions, ultimately, a condition of emphysema will appear. Emphysema means in a localized area, traffic is not going in, traffic is not going out. Whatever is the garbage, that garbage will remain there. But on the contrary, the food which was supposed to come into these localized cells is not coming up. And ultimately, it is indicated by ecchymosis, by hematomas, by swellings, pain. All these things can come up when there is a deviation of the trachea or something, emphysema type of conditions in the neck. So you remember that emphysema, mostly because this emphysema term is used mostly in the lungs. When any portion of the alveoli, localized area, is blocked, garbage which has to come out, just like the hydrogen gas or carbon dioxide gas or various other gases which are accumulated from the whole body and has been shed off there by the blood, it is not going out. And also the food and air which is usually supposed to come and go into the cell is not going there. And mostly in the lungs area, we use this term known as emphysema. Means in localized area, suppose if you breathe and you put the stethoscope on your chest, you can see the movement in this stethoscope that either the air is not going and air is not coming. Blocked area. Otherwise, if our normal chest, if you see that and you are using the stethoscope, you will see that the air is coming to the lungs, air is going out from the lungs, and between that air there are many things are replaced. But this is not going over there. This is known as emphysema. So there is this big detail still remaining. We will discuss it tomorrow, and that will be a Hindi portions. In Hindi portion, the remaining portion of the uh, external changes of internally damaged neck structure will discuss tomorrow. Again, I am your host, Gurdeep Singh Sandhu, homeopathy consultant, and my phone number is 408-687-1899. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. Anytime, if you are suffering from any disease at any time and you are not getting well or your treatment is not improving, you can call me to find it out. What are the reasons behind this, that why you are not improving, whether the treatment is wrong, whether this something is wrong in your system, whether the disease is of this nature that it is not progressing. So anything If ever happens, you can discuss with me and I can give you my best opinion based on my 52 years of experience. Rabarakha will see you tomorrow at 408 687 1899. God bless you all.